Okay, so that's what it is. Let's jump into why is it hard to diagnose. So there's a couple reasons, but let's just start off here. So the symptoms are often pretty mild. So it's called walking for a reason. Kids just don't look that bad. Maybe they're just walking around and have a lingering cough, maybe some low-grade fever, something like that, but they're doing okay. And so it's not really sending any red flags up or putting people's antenna up. And not only that, but a lot of the symptoms really look like a viral illness. So things like cough, sometimes you have upper respiratory infection symptoms, low-grade fever. These could all be seen with viral illnesses as well. But then to make matters worse, I found this study from 2018, and you can see down below, viral co-infection occurred in 27% of cases. So this means that even if you have atypical pneumonia, you might also have a virus infecting the lungs, complicating issues and making it seem like it's a viral infection. This at least is showing typical symptoms and the time course they usually occur in. So the incubation period is quite long, 2 to 4 weeks, but when the clinical illness starts, you can see you've got headache, tiredness or malaise, fever, sore throat, cough. You often have sputum production, but not always. And then the dullness and rales is saying you often have abnormal breath sounds, but not always. And then similarly, with X-ray findings, they tend to occur earlier in the course. And so you can see on the right that there are certain things that tend to come up more frequently than others. So fever and cough are quite common, fatigue is common, shortness of breath. But when you start to go down a little bit further, and even when you get to shortness of breath, 1 in 3 patients won't really have that. And so there's nothing specific that just tells you, okay, this is mycoplasma for sure. This is not a virus. And so this is why it presents a diagnostic challenge.